If you ate a small bit of ginger every day, you might feel your stomach calm down, your joints move a little easier, and even see a few numbers at the doctor drift in a better direction. Bold claim? Sure. But is it real or just hype? Today, we'll walk through what daily ginger can actually do for your body, how to use it the right way, and how to avoid the common mistakes that trip people up. Before we dive in, quick question. If one simple kitchen habit could help you feel lighter after meals and a little less stiff in the morning, would you try it for a few weeks? Let's start with what most people get wrong. Many seniors pop high-dose ginger pills on an empty stomach and then wonder why they get heartburn. Others grab sugary ginger candies or soda and think it's the same as the real spice. Some ignore how ginger might mix with their medicines. And a lot of folks expect a miracle by tomorrow morning. Sound familiar? Good, because we're going to fix every one of these as we go. Now, what is ginger in plain English? Ginger is a root. Inside it are natural helpers called gingerols and shogaols. These tiny compounds can calm some of the body's fire signals inflammation and help the stomach move food along. Think of ginger like WD-40 for your stomach's gears. It helps things move more smoothly so meals don't feel stuck. Here's where most people notice a change first. Digestion. Many folks 50 plus feel heavy after meals, bloated, gassy, or just off. Daily ginger can help the stomach empty a bit faster and support the stomach's natural squeezing motion. That can mean less heaviness after dinner and a calmer belly at night. Quick check-in. Would you enjoy your evening more if that brick in the belly feeling showed up less? While we're on the tummy topic, let's talk nausea. Ginger has been studied for different kinds of nausea. It's not magic for every type, but many people find it soothing for everyday tummy upset. Here's the catch. It tends to work best as a food-first habit, like warm ginger tea with a meal or grated in soup, not as a giant capsule on an empty stomach. When in doubt, start with real food forms and take it with food. Let's move from the stomach to the joints. Can ginger help achy knees or stiff hands? Some studies show small improvements in osteoarthritis pain and function. Other studies are more mixed. Here's the honest truth. Ginger won't replace your treatment plan, but daily use may give you a modest nudge toward comfort, especially when you pair it with gentle movement, a bit of strength training, and steady walking. Ask yourself if a simple kitchen habit might take the edge off stiffness even a little. Is it worth a try? What about the heart and blood pressure? Some research shows ginger can slightly lower blood pressure over a couple of months, especially at higher supplement doses. We're talking small, helpful nudges, not giant drops. Ginger may also help your cholesterol profile a bit, like lowering triglycerides or LDL for some people. But let's keep it real. Your overall food pattern, daily movement, sleep, and any prescribed meds do most of the heavy lifting. Now, let's clear up a common rumor: blood sugar. You might hear that ginger fixes blood sugar. The balanced view is this. Some studies show modest benefits in long-term blood sugar control, while others show no clear effect. So don't count on ginger to replace your plan, but do count on it as a tasty, low-calorie spice that fits a blood sugar-friendly way of eating. So far, we've looked at what the research suggests. But how might daily ginger feel in real life? After a few steady weeks, many seniors report. Meals sit lighter, less post-meal heaviness or gas. Small comfort wins. Joints may feel a bit easier in the morning. Food tastes brighter, so it's easier to cut down on salt. Nice support for blood pressure over time. Ready to make this simple and safe? Here's a 2-step ginger plan you can start this week. Step 1. Start low, go slow. Food first. Begin with real ginger. Thin slices in tea, grated into soup or a stir-fry, or a small pinch of ground ginger in yogurt or oatmeal. Always try it with meals. This lowers the chance of heartburn and helps your body handle it better. Step 2. Build a steady habit. Aim for a small daily amount you enjoy. Many studies use around 1 to 3 grams per day. Think about a teaspoon of ground ginger or a thumb-sized piece of fresh ginger across your meals. More isn't always better. Too much can lead to heartburn or loose stools. Small and steady wins. Here's our second and final analogy to keep it simple. Imagine certain body signals like discomfort or cranky stomach have a volume knob. Ginger can help turn that knob down a notch, not off, just down. Now, remember those common mistakes? Let's fix them one by one with smooth, practical swaps. Mistake number 1, big pills on an empty stomach. Here's how to fix it. Take ginger with food. Try morning ginger lemon tea with breakfast or grate a little fresh ginger into your lunch soup. Mistake number 2, sugary ginger products. Here's how to fix it. Choose real ginger, fresh, dried, frozen, or unsweetened ginger tea. Ginger ale and ginger candies are usually sugar with a hint of flavor. Mistake number 3, ignoring medicine interactions. Here's how to fix it. If you take a blood thinner like warfarin or antiplatelet medicine like aspirin or clopidogrel, talk to your doctor or pharmacist before adding daily ginger. And if you have a surgery or dental procedure coming up, let your care team know about any ginger supplements. Mistake number 4, expecting a miracle. Here's how to fix it. Give it 4 to 8 weeks as part of a full routine. Better meals, hydration, walking, and light strength work. Ginger supports good habits. It doesn't replace them. So how do you actually add ginger to your day without changing your whole life? Try these easy, senior-friendly ideas. For breakfast, warm ginger cinnamon oatmeal. Stir a small pinch of ground ginger as it cooks. During tea time, fresh ginger tea, thin slices in hot water plus lemon. Sip it with a meal or snack. For lunch, chicken ginger soup. Grate fresh ginger into broth for a soothing, savory lift. Dinner idea. Ginger garlic stir fry. A little minced ginger with olive oil, veggies, and your protein. A little evening treat. Ginger turmeric golden milk with low-fat milk, or a fortified unsweetened milk alternative. Which one sounds easiest for you to try this week? What if you prefer supplements? Food first is still best, but if you want a capsule, look for third-party testing on the label. USP, NSF, or similar. Keep the dose modest, close to food level amounts. Make sure to take it with a meal to reduce stomach upset. Track how you feel. If you notice heartburn, easy bruising, or unusual bleeding, stop and call your doctor. So, who should be extra careful? If you're on warfarin or antiplatelet meds, talk to your doctor before taking ginger daily. If you have reflux or frequent heartburn, start with tiny amounts, always with food, or skip if it bothers you. If you have upcoming surgery or dental work, mention any ginger supplements to your healthcare team. If you take diabetes medications, remember ginger won't replace your plan. If you change supplements, check in with your doctor so your meds stay right for you. To make this super simple, here's a 7-day ginger kickoff to build momentum. Day 1 to 2, 1 cup ginger lemon tea with breakfast. Thin slices, steeped, sipped slowly. Day 3 to 4, keep the tea. Add a pinch of ground ginger to oatmeal or yogurt. Day 5 to 7, make a ginger garlic veggie stir fry or ginger chicken soup for dinner. Each day, jot a tiny note. How did my stomach feel after meals? Any change in morning stiffness? Energy? Look for small wins. Hope you found this video helpful. If so, we'd appreciate it if you give it a like. Also, subscribe to the channel if you haven't already and tell me in the comments, what's one easy way you'll add ginger this week? Or if you're already using ginger on a daily basis, we'd love to hear about how it's helped you. Plus, your story will inspire others to give it a try. Have a wonderful day, and I'll catch you in the next video.